Hi, you're here today for pre-op for Dr. Misty Suri's hip scope surgery. Today we're going to go over all the information you need to know to get prepared for that hip scope surgery. The first thing you're going to find in front of you is going to be a red folder, and it's going to be like this. And inside that red folder, you're going to find all the information you'll need, a bunch of different sheets of paper that go over everything you need to know for hip surgery. The first packet of paper you're going to find is going to look like this, and you're going to have two copies that are exactly the same. One copy is for you to read over and take notes on. The other copy is for us. You are to bring one copy with you on the day of surgery, and I'm going to write "Bring to surgery" on the top of one of those sheets to remind you to do so. We'll take that sheet from you on surgery day, and after your surgery is complete, Dr. Suri will fill out this sheet with all your instructions, with exactly what he did during surgery and everything he wants you to do after surgery. He'll discuss that sheet with your family and give that to them after surgery, and you'll go home with it. After surgery, you're going to have two incisions on the outside of your hip. Those incisions are going to be about 2 centimeters in length. It's going to be a straight line, a little bit bigger than the width of your thumb. And those incisions are both going to be closed up with nylon suture. So it's a black suture that you'll see. Over the top of that, you're going to have a little yellow dressing. That's a zero form dressing that helps the incision to heal. And then on top of that, you're going to have some gauze taped to your hip. So you're just going to see a square of gauze that's going to be taped down to your hip. We want you to leave that on your hip for 2 to 3 days after surgery. We don't want you to get that area wet. Just sponge bathe for the first 2 or 3 days. On the second or third day after surgery, you can remove the gauze, and then you'll see each one of those incisions. You can take the little square of zero form dressing off and throw it away, and you'll see the black nylon sutures over each incision. At that point, we want you to buy some waterproof Band-Aids. You can buy any kind of waterproof Band-Aids. We recommend NextCare waterproof Band-Aids. There's a picture of that box in your packet, but you can get any kind of waterproof bandages, and we want you to cover each one of those incisions with the waterproof bandages, because we want those incisions to stay clean and dry for 2 weeks after surgery so that the skin will heal and no water or infection will get into the incisions. Another thing that you're going to notice on your hip after surgery is going to be some TENS unit pads. You're going to have 4 white TENS unit pads with little white cords running from each pad around your incisions after surgery. Those pads are removable little sticky pads that are going to be around the incisions like the 4 corners of a box. And the gauze wrap is going to be taped on top of those. So all you're going to see is the cords running out from the TENS unit pads. That's because we want you to leave the gauze wrap on your hip for 2 to 3 days without changing it, and so you'll be able to access those TENS unit pads during that time. Those TENS unit pads plug into a TENS unit. You should be getting a call, or should have already received a call from a TENS unit company that we've sent a prescription to for you, and that is to supply you with a TENS unit device. We feel that the TENS unit device does help greatly with pain relief, and we recommend that you get it. This device would be shipped to you by a company called Zynex Medical, and you plug the electrodes into the TENS unit, and the TENS unit sends a little electrical impulse to the muscles to stimulate the muscles and confuse them from recognizing pain after surgery. The TENS unit is an optional device. If you don't feel like you want to get it, you don't have to. It's not going to magically help you heal faster or slow down healing. It just helps to control pain. Again, we recommend it to help control pain after surgery. Most people feel like they need it after this surgery and find it beneficial, but it is up to you. There is a sheet in your packet that gives you the number for the Zynex 10 unit company in case you missed their call. Also, in your packet of paper, there is a website address that you can go to that's on Zynex website, and that will show you exactly how to use the TENS unit. We want you to use it on the TENS setting, that's TENS. So when you turn it on, it has 3 settings that you'll see immediately. You move the arrow down to the TENS unit setting, and then you select it. Once you select it, there'll be 3 more options, and we want you to pick SWP, which stands for sweep. Once you choose that, then you dial up the TENS unit with the 2 arrows up to the intensity that you like. Once you feel like it's at a comfortable level, you leave it there, and it'll send those little impulses to your muscles. You can't really hurt yourself with this device, but we want you to be comfortable when you're using it, so just dial it up to the intensity that best suits you. After surgery, you will need crutches to help limit the weight bearing on your hip that we've just operated on. Those crutches will be fitted for you and supplied to you at the hospital at which you have surgery on the day of surgery. If you have crutches that you wish to use for surgery, you do need to bring those with you on the day of surgery. The hospital staff will want to physically see those crutches. If they don't, then they will supply you with another pair of crutches to go home with. Those crutches will be used for 3 weeks after hip surgery to limit your weight bearing on that hip. That will help what we did in surgery heal. So we do some stuff to possibly your labrum or your hip capsule that will need to heal, and limiting the weight on that hip will help those things to happen. We're going to want you to only put 25% of your weight on the surgically repaired hip for 3 weeks after surgery. 25% of your weight is what we call toe touch weight bearing. So just gently touching your toes to the ground, not putting much weight on your surgery leg at all, about 25%, using the crutches for 3 weeks after surgery. Again, this will let what we did heal inside the hip. After that 3 weeks, you will be able to wean off the crutches and go back to normal weight bearing. When you wake up from surgery, you're going to have 3 types of equipment that's going to be on your body after surgery. The first thing is going to be an ice pack. The ice pack sits on the outside your hip, kind of right over where we did surgery, and it velcros around your waist. It's got a tube that runs down from it that plugs into a square igloo ice unit that sits on the floor. You fill this ice unit up with ice and water, and you plug it into the wall, and it circulates cool water through the ice pack. So it's like an ice pack that takes a long time to warm up and stays cold for a long period of time. This will be filled up with ice and water at the hospital and will be on and running when you wake up following surgery. You're going to go home with that equipment after surgery, and it's important you use that aggressively to help the pain in your hip. Everyone says that icing the hip works the best to help control the pain after surgery. So we want you using this device 30 minutes on, 30 minutes off, as many times as you can to help pain and swelling in the hip. On top of that, you're going to have a hip brace, which we'll show you in just a little bit, and that hip brace velcros around your waist, and then it also straps around your hip. That hip brace is going to be set from 0 to 90 degrees. You won't have to adjust that. And we want you to wear that hip brace for 2 weeks after surgery. That helps to restrict some motions of your hip and protect your hip following surgery to let what we did heal inside the hip. You're also going to notice that you're going to have some foam boots velcroed around your feet, and those are going to be velcroed to a cylinder pillow when you wake up from surgery. We want you to wear those at night when you're sleeping for 2 weeks after surgery to help keep the lower extremities in a stable position to let what we did during surgery heal. The reason those are on is because you're just waking up from surgery and you were sleeping, so that's why those are in place. You only need to wear those when you're sleeping. The hip brace is for when you're awake during the day. When you're sleeping at night, you can take the hip brace off and put your feet in the foam boot and pillows, and that should stabilize you when you're sleeping. Sometimes I will tell people to keep the brace on at night when they're sleeping, and that's because if you usually wake up in the middle of the night to use the bathroom, and you go to get up to go to the bathroom, we want you to put the hip brace on to go to the bathroom. It doesn't matter how close the bathroom is to your bed, we want that hip brace on if you're getting up and moving around. And the reason for that is because it protects your hip in case you were to slip and fall on your way to the bathroom. You could mess up what we did and we'd have to do the surgery all over again. So for some people, I tell them, look, if you don't want to mess with this brace in the middle of the night, I would keep it somewhat strapped to your hip, and you can just loosen up the straps when you're sleeping, and that way if you wake up in the middle of the night, you just tighten it and you go to the bathroom. So after you come out of surgery, you're going to have this hip brace around your waist, and it's going to be strapped around your thigh. This brace is going to help to keep your hip in a certain position and prevent certain movements of your hip that would cause problems after surgery. So we want you to wear this hip brace when you're awake, and it wraps around your waist. It's got a hinge here that's going to sit right at about your hip joint, and then it's going to wrap around your thigh like this. This hip brace can be taken off by unvelcroing the waist strap. So you can unvelcro it and velcro it back. It can be adjusted by this velcro piece here. Can come off, and you can cut this underlying piece if it's too long. You can also do the same thing on this piece. This little end piece can come off, so you can cut this part as well. So you velcro it like that across your waist. This little piece here that has a little elastic on it is the fine traction. So this is how you tighten it generally, and then you can fine adjust it with this strap right here. This will tighten it up just a little bit more if you need it to. This hinge is going to be set from 0 to 90 degrees, and we don't want you to adjust that at all. You don't need to lock it. You can leave the brace unlocked at all times. If for some reason it gets locked, that would be when this orange switch flips down, and it would prevent you from moving it. You can just flip it up, and it'll let you move it from 0 degrees, which is straight, to 90 degrees, which is bent up like this. And don't adjust that. Also, around your lower leg, this strap will strap around and hook on to the brace like this. Those straps are coming from these two things to secure it to your thigh. You can lengthen and shorten this bar by flipping this open like that, and then you can lengthen this out and raise it up depending on your height. It should already be adjusted when you come out of hip surgery, but if you need to adjust it more, you can always do that. It's got a switch up here that also allows you to lengthen this top bar up and down. You flip it like that to lock it closed. This little buckle here opens, and that lets you kind of tighten some of this strap from the back. It doesn't move much when you do that, but that does give you some additional tightening if it's not fitting right. When this is pushed over, it's locked, and it's not going to let the tension out from this back strap. Here, on this lower thigh strap, it has a couple of Velcro pieces in addition that you can also kind of take off and tighten as well. So this can move this little strap up and down so that you can adjust it on your hip. And the other thing is that if you ever have any problems understanding how to adjust your brace, the name is on the brace. It's called a Breg T-scope hip brace. and that's BREG T-scope hip brace. If you Google that on the internet, you will be taken to the company's website, and they have a great instructional video. It may also be on YouTube that'll show you exactly how to break down the whole brace and adjust it. That's a very useful video if you have any questions or concerns after surgery. You can always reach out to us, or when you come for physical therapy, they can help adjust your brace. After surgery, you're going to wake up in these two foam black boots and this foam cylinder pillow. You're going to wake up in these because you're going to be sleeping after surgery. This apparatus is to be worn at night when you're sleeping. You can unvelcro each one of the boots and slip your feet in and out. Each one of the boots also velcros to the cylinder pillow. I would recommend that when you go in and out of it, you just unvelcro each boot from around your foot and slip it in and out, instead of breaking the whole thing apart and detaching the boots from the pillow. It's kind of hard to adjust the boots to the pillow, and so it's much easier if you just undo the boots and take your feet in and out. The boots velcro to the pillow in the back by a little velcro strip. They actually have two of those in the back that attach the boots to the pillow, and each boot has these little velcro pieces here that will tighten the top and tighten the bottom so that your foot is nice and secure in that. Next, we're going to talk about eating prior to surgery. We're going to call you with an arrival time for your surgery. Whatever time we give you, there's no eating 8 hours prior to that arrival time. This includes gum, hard candy, mints, chewing tobacco, or anything you put in your mouth. Once you're inside of that 8-hour window, you can continue to drink water or clear Gatorade up until 2 hours prior to your arrival time for surgery. We do want you to drink some water or clear Gatorade prior to surgery, because that helps to keep you hydrated, which helps things to go well for surgery. But once you're inside of 2 hours prior to your arrival time, we don't want you to eat or drink anything until after surgery. The next sheet you'll find in your packet of papers will be a sheet that instructs you to call us between 12 p.m. and 4 p.m. the day before surgery to find out your arrival time for surgery. You only have to do that if you do not hear from us by 4 p.m. Otherwise, we will call you the day before surgery between 12 and 4 p.m. to let you know your exact arrival time for surgery. That's because Dr. Suri has some surgeries come and go off of his schedule, so we will finalize the surgery schedule the day before surgery and call you to confirm your arrival time. Your time will likely be early in the morning, sometime between 5:30 and 11:30 a.m. The time that we tell you is very important, and it's important to arrive promptly at that time. We have to prep you and clean you for surgery, and if you arrive late, this could cause a delay in our surgery schedule and could cause your surgery to be delayed, and it could get pushed to the end of our surgery schedule that day. The other thing is we want you to get either Hibiclens cleaning soap, which is a strong antibacterial soap, or Dial antibacterial soap, which you can find at any pharmacy. Both of those soaps can be bought without a prescription. We recommend the Hibiclens, and we want you to shower from the neck down the night before surgery and the morning of surgery to get you as clean as possible. It is important to scrub the surgical area thoroughly, but not too hard to cause abrasions. On the day of surgery, after you shower in the morning with the soap, we don't want you to put anything on your body. No deodorant, no body lotion, no cologne, no perfume. We want your skin as clean as possible for surgery. It's important that you remove all jewelry, metal, piercings from your body prior to surgery. If you have a piercing or ring that you cannot remove from your body, it's important that you address that with us or anesthesia prior to surgery. Also, please be careful not to get any cuts or abrasions around your surgery site prior to surgery. I would not shave your surgical extremity. We will do that on the morning of surgery. If you get any new cuts or abrasions around your surgery site, we may have to cancel surgery for risk of infection. In your packet, you will also find a sheet on how to take pain medicine. It's got some things with examples of how to do it and explains to you how to rotate or alternate your pain medicine. At the bottom, we have an option for severe pain that you can follow if you're taking all the pain medicine as it's prescribed and you're still having severe pain. These options let you do little small increased amounts or frequency of those doses for little short periods of time, so you can always read over that. Some tips are that pain medicine contains Tylenol, and it's also important that you do not exceed 3,000 milligrams of Tylenol in a 24-hour period. That's also at the bottom of this sheet. After surgery, you're going to have your pain medicine that you can take for pain after surgery. We only want you to take that as you need it for pain. And then you're going to have your nausea medicine that you can take in case you have any nausea. In addition to those 3 medicines, you're going to have 3 more medicines that we want you to take after surgery. Those prevent heterotopic ossification from forming in your hip. This is a very rare condition that can happen after a hip scope surgery. It's a calcification type process that can form anytime you have this type of hip surgery done. It's very rare, but taking these medicines help to make that extremely rare after surgery. These medicines are non-steroidal anti-inflammatory medicines, and you're going to have prescriptions for them. The first one is going to be Indocin, and it's a medicine that you'll take 75 milligrams for 5 days. Once those 5 days pass, you're going to run out of that medicine, and then you're going to start naproxen, which you're going to take for another 21 days, and you're going to take that twice a day. Both of those medicines we want you to take with food. They're acidic type medicines and they can be a little rough on your stomach, so we want you to take them with food to help buffer that acid on your stomach. The other thing is we recommend that while you're taking those medicines, we want you to get a prescription of Prilosec, which we'll send to the pharmacy for you to take during that 25-day course, and that will help to keep the acid pumps down in your stomach to reduce the stomach acid so that you don't get a stomach ulcer after surgery. That medicine usually is to be taken in the morning, kind of separated from your other medicines. You usually take it for about 30 to 60 minutes prior to eating, and then you take your other medicines kind of after that as you need them. Those medicines will be called into your pharmacy, and we recommend you starting those on the day after surgery. The next thing you'll notice in your packet is a sheet that goes over warning signs for blood clots after surgery, which are also called DVTs. This sheet goes over signs and symptoms of a blood clot. Surgery puts you at risk for blood clots, and those can occur in any extremity after surgery, your arms or your legs. It's important that you know the signs and symptoms, and if you think you're getting a blood clot after surgery, please call us so we can address those concerns. And if we suspect a blood clot, we will more than likely have to get an ultrasound to rule that out to make sure that you don't have a blood clot. If you can't get in touch with us and you think you're getting one of these, we suggest go to the emergency department for surgery. It's also your responsibility that if you are over the age of 40, you get surgery clearance from your primary care doctor. We should have instructed you prior to surgery if you needed this or not. If you are instructed to get it, it's your responsibility to get this prior to surgery. And if for some reason you do not have this prior to surgery and we do not have documentation in our office, your surgery procedure will be canceled and delayed until we get it. It's also important to remember to read over the information and the pieces of paper that we have given you prior to surgery. The videos are a good tool to help you get prepared for surgery, but the packet may contain a few small things or some more details that were not discussed in these videos. Between the videos and the information in the packets that we have given you, you will be prepared for surgery and know everything you need to know to have a great outcome after surgery.